Hi, welcome back to Inclusion Spectrum Story. Today, we are going to talk about the Social Communication Questionnaire, or SCQ, a widely used screening tool that helps identify signs related to autism spectrum disorder. The SCQ is a parent report questionnaire. This means it is usually completed by someone who knows the child well, such as a parent or caregiver. It is designed for individuals aged 4 years and older, as long as their mental age is above 2 years. So, what makes the SCQ useful? It is usually based on a longer and more detailed assessment called the Autism Diagnosis Interview Revised, or ADIR. The SCQ takes key parts from that interview and turns them into a simple set of 40 yes or no questions. Because of this, it is much faster to complete, usually taking less than 10 minutes. There are two versions of the SCQ. The lifetime version looks at the individual's developmental history, while the current version focuses on behavior over the past 3 months. The questionnaire looks at 3 main areas, which are social interactions, communication skills, and repetitive behaviors and restricted interests. Each response contributes to a total score, and the higher scores may suggest more autism-related characteristics. Now, let's talk about scoring in a simple way. The SCQ has 40 questions, but only 39 are scored. The first question is about speech, so it is not included in the total score. Each answer is scored based on the official scoring key, so it is important to refer to the scoring guide because not all answers are counted in the same way. After scoring each item correctly, you add up all the points to get a total score out of 39. So, what does a score means? If the score is 15 or higher, it may suggest signs of autism and a full assessment is recommended. If the score is below 15, it usually means fewer signs, but it is still important to monitor if there are any concerns. For younger children, some professionals may use a lower cutoff such as 11 or 12. However, it is important to remember that the SCQ is not a diagnosis tool. It is only a screening tool, which means it helps to decide whether a more detailed assessment is needed. Because it is a quick, cost-effective, and easy to use, the SCQ is commonly used in schools, clinics, and research settings. If you are a parent, educator, or professional working with children, understanding tools like the SCQ can be a helpful first step in supporting early identification and intervention. If you found this helpful, don't forget to like, share, and subscribe for more content on autism spectrum. Thanks for watching. See you in the next video.